Hi, had a request from Holly to do a vlog on high hamstring tendonopathy. So I thought we'd just start a little bit about talking about that. We can go back to our one of our previous talks, which is all about taking control, and break it down into three aspects. What's the cause of it? How do we release it? And how do we reload it? Now, when we're talking about hamstring issues, when we're talking about tendon issues, and in this case the hamstring, one of the sort of most effective proven way of treating them is to reload it. But you've got to reload it gradually and slowly and not provoking the pain. So one of the key things is to minimise the causative factors and then reload the hamstring as sort of gently as you can without sort of causing symptoms. So first, if we think about what the causes of your hamstring, high hamstring issue, as I'm sat here talking to you, I'm thinking, well, one of the first causes could be too much sitting. The big problem with the big problem with tendons is compression. And that compressive load into flexion is one of the big things that causes and is one of the most provocative things for the sort of hamstring tendon. So it could be that you've all spent a lot more time at the moment working from home, sitting on poor chairs. You know, you've got your knees higher than your hips, and actually that hamstring's actually ended up on stretch, on compression, much more than it should do. It could be that we've just overloaded things. We've done more miles, we've done harder miles, we've done more hills. Hills are another provocative factor for high hamstring, because in order to get up a hill, we have to flex our hip a bit more. And in turn, anytime we compress and flex the hip, if you think about the position of the hamstring insertion and tendon, it's actually, as we flex the hip, it's actually compressed against the ischium a lot more, and it causes increased load. So it's that compressive stretch. So thinking about the cause: load, more hills, more sitting, increased weights. You know, you could be doing more squats in the gym and actually just not having the strength and the control to actually take the squats down as far as you're going. So lots of causative reasons from an external factor. So if we start then looking at an internal factor, what of the sort of extra load caused on the body? So yes, the hamstring is stressed and overloaded. However, it could be that something else is tight first, and a lot of patients I see with hamstring problems generally have got stiffness in the lower back. So if you've got stiffness in your thoracolumbar junction of your back, so just that sort of upper part of the lumbar spine, then you tend to lose your hip extension. So your hip extension is where your leg comes back that way. So if you lose your hip extension, your hamstring and your glutes have got to work much harder to actually pull your leg into hip extension. So they're working against resistance rather than working through a smooth range of movement. So if you've got a tight back, you've then got tight hip flexors, you're tight in the front of the hip, that means the hamstring's got to be overloaded. So these are all factors that we need to look at as to what's actually causing the hamstring. Obviously, it's not something that you can do yourself. It's much harder to do yourself, to assess your lower back. But what you can do is you can lie on your tummy, you can bend the knee, you can try and lift one leg up in the air, and you can try and lift the other leg in the air. You'll actually probably find that the one with the hamstring problem it's much harder to lift, probably because the hamstring and the glutes are weak, but it's probably also much stiffer in the lower back. You can do a little bit of work inside lying. You can sort of lie yourself on your side, and you can just get into those joints a little bit and just see, what do they feel like? You'll feel a lot of muscle tension, but if you just go through that muscle a little bit, you can just sort of feel what's going on and just think, right, let's just try and just move things a little bit in there, just release things. And then feel the other side. You think, oh, well, actually, that side feels really quite normal. And then you can start to get an understanding that there's a bit of stiffness on one side compared to the other, and that's what's causing your tightness. So start off by having a little feel into your back. See, is there something a little bit higher up that's causing the hamstring? So one of the big mistakes I think people make with hamstring, high hamstring tendonopathy is too much stretching. Hamstrings, tendons don't really like stretching to start with. It's a bit like scratching an itch. It might feel a little bit better to start with, but it's actually not doing an awful lot of good. And actually, by stretching out the hamstring, you're increasing the compressive forces on the tendon, and that actually is going to irritate them to start with. Something we can introduce later on into the rehab, but to start with, actually less stretching is better. And what we actually want to do is take off the flexion forces, so any compressive forces on that tendon, so any forces where your hip is flexed into this position, so that's sitting. So, you know, if you're having to do a lot of sitting, one thing you can do is put a cushion on your chair, so you're actually a little bit more raised, so your hip's higher than your knee. Avoid running uphill. You know, if you can still run, great. If you can't run, then, you know, try some walking, but avoid hills to start with. If you can run, stop hills and just take, you know, if you get to a hill, just walk up it, because again, that's going to increase the compressive force and actually make it worse. Don't squat. And probably don't really do lunges with that leg going forwards, because all of those things to start with will massively irritate the tendon. So now we've actually worked out what's causing it. How do we release it? We've talked about the lower back a bit. You can get in there, you can do some rotation stretches, you can do some hip flexor stretches. Probably what I wouldn't do at this stage is stretch the hamstring. You can do a little bit of release work where you can sort of hold your hamstring, the back of your hamstring, and just do a little bit of active work just to make sure that the main belly of the hamstring's not tight. But again, that's probably not a great position to show you in, to be honest with you, because actually that's putting it into compression. But you can just do a little bit of work like that, but probably bring that in a bit later. You can do a bit of foam rolling into that hamstring. I would foam roller into the glute, that's okay, and foam roller into the front of the hip, that's fine. Stretch out the front of the hips, that's good, but don't stretch the hamstring so much. And so once you've sort of released around there, then you can start a little bit of loading. So really what you've got to think about with your loading is take the hamstring out of the provocative positions. So don't take it into flexion, take it into extension. So you can start with some very, very simple positions. Glute bridge is always my favourite one for hamstring loading. Your hamstring is in extension, it's moving into extension, it's taking it out of a provocative position. So you should be able to do some low-level loading through the glute bridge quite nicely to start with. So if we just move down, so we can sort of have a little look at that. I think if you've watched any of my videos, you'll know the glute bridge by now. Okay, and it wouldn't be an ASICS video if we didn't have a little doggy starring in it. Here you go, this is Bluebell. So we get down on the floor for our glute bridge and we just rock our pelvis back. We start off with two legs and we just lift the pelvis off the floor, okay? Make sure you're engaging your glutes. And then, you know, start off like that and think, right, that's okay, I can do that nice and comfortably. So just do sets of that, 10 sets of 10 seconds. And then when you think that's okay, you can just start lifting one leg up, okay, keeping the pelvis still and just seeing what's going on there. If you want an intermediate phase to lifting the pelvis, to lifting one leg, then you can start going onto the toes of one foot and just hovering the foot off the ground. You might find that's not quite so hard and doesn't give any symptoms at all. So once we've done the glute bridging, we can start doing some long lever isometric work. So this is really lying on our back and just pushing the leg into the ground, okay? And you think, okay, that's good. I can actually do some pushes into the ground and just hold it there. And then I think, okay, can I do some in that position? Yeah, that's okay. And you can just gradually just start bending the knee a little bit. So you're just starting to load the hamstring gradually through a little tiny bit of flexion, but we're not working into a deep flexion. And actually we're not, the hip's still extended, so it's not too bad a position. Then we can do a similar sort of thing in standing. So we can stand, and you basically, you can just start pushing your leg into a wall, and then, you can't see that very well there. So you can just start with a long lever, just pushing your leg into the wall like that. And then obviously we can then go on to working on one leg and just trying to get the control and balance, because a lot of what we'll have lost doing lots of overwork is just that control and balance. So can I stand on that leg? Great. Okay. Can I bend the knee? Yeah, I can get some decent control in that. We don't go too far because, again, we're just doing a little bit of loading. We're not doing lots of loading. And think, right, okay, I can just start bringing in some little squats. So just keeping the core working, everything nice. So we're just getting some low level squats. Okay. And then the next stage from that progression is some low level step ups. So again, we're starting to bring a little bit more flexion in, but as long as everything's been okay, you can have done, you can also add in some work if you're in the gym and you've got a hamstring sort of curl machine lying prone on your tummy, pulling your leg up. So again, long lever. It's better than the seated hamstring pull to start with. And again, just gradually work through that loading. So I think the key really is avoid the provocative factors, which is that compression of the tendon in sitting. Understand that actually tendons need load, but they need a low enough level load to actually allow you to start building up pain-free. Monitor your symptoms, make sure your symptoms, make sure your exercises aren't increasing the symptoms, and decrease the running at the moment to a low level. So hope that makes sense a little bit. That's my thoughts on sort of high hamstring tendon. The biggest mistake I think people make to start with is too much stretching. And also, I think the other big mistake is too much hands-on treatment into the hamstring and the hamstring tendon. It's okay to work higher into the back. It's okay to make sure the leg can move, has got its full function, because if it's not got its full function and it can't extend properly, it's going to have to work a lot harder. But it doesn't really like lots of battering into the hamstring and onto the tendon. Doesn't really help. So minimise the symptoms to start with, get rid of the aggravating factors and reload gradually. Start off on the floor, then go into weight bearing, 2 legs, 1 leg, then add weights, then make it harder. And again, with the running, you can start off, if it's painful to run, start off walking. If walking's okay on the flat, then you can introduce hills. If hill walking's okay, then you can start easy running. If easy running's okay, you can introduce a little bit more speed and volume. If that's okay, then finally bring in the hills. So hopefully that helps, just to give you a little bit of a sort of thought on the hamstring. Right, see you folks, happy training.